Good day, everyone. So we are now on our discussion for the final period of our course, NCM 110 Nursing Informatics. The first topic, which is the topic 8 that we will consider for the final period of the Nursing Informatics, is related to the knowledge management and information technology service. Uh, our discussion will entail a more realistic presentation because knowledge management and information technology service that I will discuss in today's class will consider the services rendered by the Department of Health, which mainly considers the principles and concepts of knowledge management and information technology. The Department of Health is committed on how it will improve mainly the operations when it comes to the information technology, wherein we are considering also the nursing informatics because most who attends to our clients in a hospital-based or in a community-based setting are definitely nurses. And we all know that since nurses are the ones who are immersed in this healthcare facilities or settings, they are the ones also have the major role when it comes to the processing of data to information, then knowledge until it will be used by the community or utilized by the community. It aims with the perspective on the implementation also of our previous topic related to the national e-health and in the execution of the possibilities and accessibility of this information using the technology, the Department of Health have considered this knowledge management and information technology service, which is KNITS or KNITS, which is one of the division or cluster of the Department of Health. Before we proceed on these services and what are the general functions of the knowledge management and information technology service, we'll try to have first or primarily the overview of what is knowledge management and information technology. When we consider about knowledge, we have discussed before about how the data can be translated into information, then the information that can be translated into knowledge. So once this data becomes a knowledge, then this could consider a more relevant, useful, which is significant for the improvement of the operations of a certain facility or improvement of the processes of the systems and procedures either on a centralized office or central office, regional, or on a national level, which could be also on a global setting. When we define knowledge management, it is the process. If we say process, it is a step-by-step procedure. It could be considered as systematic, okay? And it entails on uh, how a person or an individual, on how a nurse will definitely consider primarily their roles on how they may consider this knowledge as useful. Knowledge management is defined as the process of capturing, distributing, and effectively using knowledge. And since we have defined before that knowledge is already useful, relevant, meaningful, because this could translate into something that may be utilized on an effective care management, on an effective implementation of policy, or an effective organizational operations. So that's why when we say it is the process of capturing how this knowledge can be retrieved, how it could be distributed, how this knowledge can be shared from one person to another person, one person to a group, one person to a department, department to another department, or from one institution to a national level. So this knowledge management entails a process on how it will start on a level by which it may include responsibilities of individuals, it could be group, or it could be organizational. And this could be effectively used and managed as well if it considers legal imperatives of its data protection and confidentiality. So those that had been discussed when it comes to Data Privacy Act here in the Philippines, then the knowledge could be effectively considered and processed if these provisions with the legal imperatives are being considered. And once this could be retrieved, shared, and effectively used, then this is what we call knowledge management. When it comes to the point that this knowledge will use a specific information technology system, this is more technical by which it answers specifically the hows. Hows, how this knowledge can be stored, how this knowledge can be protected, how this knowledge can be shared, and how this knowledge can benefit the whole organization, which eventually the knowledge management system using the information technology system, once these both concept and principles are being utilized, this may consider specifically on the perspective that it may improve what? It may improve understanding of individuals who belong to that organization. It may have more effective communication, fast-paced communication through collaboration, and it will align processes, okay? It will align processes that will help the organization achieve its objectives and goals. If we are talking about a typical example of a hospital, for example, uses hospital information system. And if we talk about the knowledge, we have already specified groups of patients which are classified with heart diseases, who are categorized with lung diseases, who are categorized accordingly with concerns on the maternal care. So on this processing of information, this could be considered as already knowledge because it specifies already a of specific identification of a certain data. Then once it will involve the information technology system, that is how the knowledge uses information technology system. So meaning, if, for example, those that I have mentioned that patients have been categorized to obstetrics, maternal obstetrics, pediatrics, medical surgical, this could be stored, okay? This knowledge and information could be stored specifically on a hardware, okay, through a software using the hospital information system, and it has features that will protect and may only consider individuals to have the access rights of this information. So that is how the knowledge management system works. Okay. Knowledge technically are those data, information, knowledge specifically processed that are being retrieved, shared, and effectively utilized by the organization. But to answer the hows, on how it will be protected, on how it will be shared, and on how it will be retrieved, it will utilize the information technology system, and that is where knowledge have been considered on how it will be stored, retrieved, protected through the use of the IT system. That is what we call knowledge management system. Okay, so I hope we have a clear perspective on how you will differentiate knowledge management from a knowledge management system. When we talk about information technology and information technology system, okay. When we talk about the information technology, it is the use of system. So kasi the system that we are talking about could be computers, telecommunications. Okay. So the study or use of systems, computers or telecommunication for purposes of storing, retrieving, and sending information. What is the difference of information technology to knowledge management? So the one that are being processed for capturing, retrieving, for sending, that is what we call knowledge management. Okay, knowledge management system. If we are about to use the computer, okay, to use already the computer, telecommunication for purposes of storing, retrieving, and sending information, that is technically considered information technology. Question, sir. What is the difference between information technology and the knowledge management system? Okay. The difference with the knowledge management system is on how the knowledge and information are being stored, are being retrieved, and are being shared through the use of information technology. Okay. So information technology are those that are being considered when it comes to the hardware, which are the computers and telecommunications on the platforms, okay, platforms that are being used, which for purpose of storing, retrieving, and sending information. Now, on a broader perspective, we have information technology system. If we are talking about information technology system, it is defined as means of computing devices, ancillary equipment, software, firmware, and similar procedure services. So the information technology system includes the support services. So this could be a more broad, okay, a more broad use of the the software, equipment, and procedures which are broad in the perspective. Example, um, information technology could be may vary from one institution to another institution. But if we will try to consider one institution such as hospital to the Department of Health, okay, the information technology system must be common when it comes to features and guidelines as well. Example, using the information technology system is from hospital is and to the other agencies or institution is the processing of PhilHealth. When it comes to the processing of PhilHealth, the hospital may have an access, okay, may have an access on the information technology system of the PhilHealth. And once there will be verifications of knowledge, it could be more broad when it comes to support services because it will entail on how the hospital will effectively uh, share and retrieve information, knowledge from the system that are being used by PhilHealth. So there must be the what we call compatibility. So this information technology system could be one institution to another institution or agency. So again, when we talk about knowledge management, the knowledge management is the process by which the information or by which it considers the capturing, distributing, and sharing of information. If we talk about knowledge management system, it is the use of information technology on how it will be processed accordingly. If we say information technology, technically it is the use of the system, use of the platform, use of computers on how it will store, retrieve, and send information. And it will, if we're talking about the information technology system on a broader perspective, this could be institution to another institution by which this could provide support services that will extend outside the institution or outside the hospital to another agency or from the external agency towards the hospital facility. Now, if we talk about the knowledge management, these are the factors and 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 basically the features by which we consider knowledge management. Just like for example, information that are being retrieved are those that are coming from the processes. Okay? Just like for example, when a client are subject for admission in the hospital, then there will be an interview. Then the interview will record those information from the client to the electronic health record. And through the electronic health record, it will now consider specifically the processing of information because it has been stored. Anytime it could be retrieved, anytime it could be shared, but on the perspective that there must be protection also. When it comes to the practice are referring knowledge management as a practice is a unified and organizational is on the organizational perspective by which it will unify the operation of the hospital. When we talk about the technology, as what I have mentioned, this is the use of the system and use of the telecommunications on how it will serve assistance on the storing, retrieval, and sharing of information. Knowledge management cannot be possible without people because the manpower is very important resource to process information. There's no knowledge management system. There is no information technology system if there are no manpower that will basically skilled and has the competencies to process all this information. Now, when it comes to the improvement, the this we are talking about are the indicators and measures how the knowledge management are being used as an indicator for the improvement and achievement of goals of the organization. Process. The process as knowledge management could translate into the what enhancement of the processes, specifically policies, guidelines, and procedures as well that will achieve the quality services. Advice. Advice could be coming from those who are experts. If they are competent and has the specific skills, then eventually these advices will definitely come from the perspective of those who may have competencies in troubleshooting. Insights. Knowledge management may refer to the insights because this may consider a logical way on how to process information. Okay, so these are the factors that are being considered in knowledge management. Information, so these are the process, data, knowledge coming from the stakeholders. Then practice, these are on the organizational perspective to unify the operations. Technology, this is the use of the computer, okay, use of the computers and telecommunication as well. People, these are the manpower that are being used accordingly with their expertise. Improvement, these are the indicators, okay, the indicators or measures of success of using knowledge management. Process, the knowledge management that may cause the enhancement of policies and procedures. Knowledge management to advices because this may entail in troubleshooting. Knowledge management to insights because this is the logical way on how to process the information systematically. Okay, now there are situations why knowledge management is an important pillar in our digital workplace. Knowledge management eventually first may increase customer service and support. To what extent that it will increase customer service and support? With with the with the database, for example, with the database system of the hospital, it will increase customer service and support because it will what? It will improve, okay? It will increase rather satisfaction of our stakeholders. It will increase convenience, okay? Convenience of our stakeholders because it may give them, okay? It may give them a more timely, okay, and realistic way of retrieving information and knowledge that they may need. Okay, so if the it may increase customer service and support when we are talking about knowledge management because this may increase also independence, okay, for individuals who may have already the knowledge to support and to act upon when the case may be it will be needed, which is for example in a hospital before, when the client will be admitted, there must be an interview of the client to eventually have the information, or if the client is unconscious, then we may consider the immediate relatives. Now, if before, every client or client's relative who will be interviewed will consider a long queue, okay, and it may need additional manpower so that to support everyone who will need to be interviewed, so that the information that will be needed will be considered for the storage in the database. But nowadays, if we are considering knowledge management in the use of the information technology, then it could be applications, yeah. It could be applications that can be downloaded into their mobile phones, and they may just enter basic information that are needed for admissions. So through these developments with the use of the knowledge management, it may increase the customer service and support because this could be integrated, okay? This could be integrated and may have the what we call access to the information or database or knowledge base. So the key term here is the increased customer service and support is because of accessibility. Okay, access. Increased customer service and support is because of the accessibility. Next, about reduced duplicated knowledge. Okay, so the integrated knowledge management system will help determine, will help determine if there are duplicate information, if there are errors when it comes to entry of data. Because for example, if you wish to process any information, you cannot proceed from from step 1 to step 2 if there are missing information that you have not filled out on the first needed information or required information. So it's a prerequisite. Before you process the next step, you need to complete those information. And if, for example, there is a duplicate, okay, there is a duplication of the the patient's code or duplication of entries, it may alert the concerned individuals that this has been already entered or already been stored on the database. So it's more on the prevention, okay, preventive prevention when it comes to error, okay. However, the manpower is still has a major key role when it comes to the processing of these platforms. How about boosting productivity? When it comes to boosting the productivity, the knowledge management can consider or may consider that the functionality. Okay, if we say functionality, if if this knowledge management system are very useful to a person who's using it, then it may increase productivity. For example, for a nurse who registered in a platform, hospital information system, and entered all those informations pertaining to medication that had been administered to the client. If the nurse wishes to retrieve information and data of medications that had been stored few weeks of his hospitalization, for example, the first week of hospitalization, it can just be retrieved with with just a one click on the menu, and may give the necessary information, may share the necessary information to authorized person who is the physician. So functionality, it may serve as a convenience, at the same time may increase a fast pace of work productivity. So when we talk about increased customer service and support, our key term is accessibility. When we talk about reduced duplication and knowledge, okay, preventive. Okay, preventive. When we talk about boost productivity, we are talking about the functionality. Okay, next. The other important pillar of digital workplace is to facilitate employee onboarding and continuous learning. So, a knowledge management system can store all types of knowledge in a single location to revisit training material or anytime. For example, on a staff development program of the hospital, since at the moment we don't have a face-to-face or limited assembly or gathering, so most of the staff development of our nurses are online or through the use of a platform or through online and by modular. Okay, so when it comes to the module one, if a nurse wish to validate her learned competencies as she reached the module 3, she can return back to the module 1 when it comes to the validation of her performance of the specific skill that requires the validation on the foundation that she have learned from module 1. So that could be, okay, that could be one of the convenience that the nurse can do, and it could facilitate continuous learning. Okay, so the facilitate employee onboarding and continuous learning is uh anytime at the convenience of the staff. She can read the modules at her convenient time and convenient place, and but still it promotes specifically learning. Okay, it promotes specifically the objectives, our objective of why we are doing the staff development program. So what is the key term here? The key term here is convenience. Increase customer service and support, accessibility. Reduce duplicated knowledge, preventive. Boost productivity, functionality. Facilitate employees onboarding and continuous learning, convenience. Okay? So these are the pillars of why knowledge management is important in a digital workplace. Now, for you to have to have a more simplified explanation on how information and knowledge management differ from each other, information management system is conversion of data to information. Okay, so because when we talk about the information management system, as what I've told you, that information management system could be in a broader perspective, because this could be institution to other institution. Compatibility of system must be a requirement so that the sharing of information will be effective. So the data that are available could be information if it is already shared. Okay, it translates into information because if it is already shared specifically to the agency to process a certain document. The knowledge management system is conversion of information into knowledge. So the difference with this is the information, the knowledge itself, or the knowledge itself or the information itself can be translated into the knowledge which could be useful for on the perspective of every individuals who belong to the organization. So a typical example here is when the information had been already stored, okay, already stored in the system through the information technology, which I told you, use of the IT system. Then when the nurse retrieved this information and become useful when it comes to the care management of the client, then that becomes a knowledge. Okay, so as what I've told you, it boosts also the productivity. So that's the difference. Information management system, the conversion of data to information, and knowledge management system is conversion of information into knowledge. Now, I will now present to you or present to you on how the Department of Health, okay, how the Department of Health attends to the needs and processes of our healthcare institutions when it comes to what? When it comes to knowledge management and information technology. So, in this consideration, uh, we have a mandate according to the Executive Order number 119 entitled Reorganizing the Ministry of Health, its attached agencies for other purposes. This is otherwise known as the Act, Reorganization Act of the Ministry of Health. So before it's Ministry of Health, okay, and now we have the Department of Health because this was the time during the presidency of Madam Corazon C. Aquino last January 30, 1987. So even in 1987 through the EO number 119, this has been already as this has been already a consideration when it comes to direction on the management of the information using technology. And that's why in this mandate, okay, from the EO 119, the Management Advisory Service or MAS was created under the Office of for Management Services, which the purpose is to have staff advice and assistance on internal control and management systems improvement. Example, we all know during the time in 1987, technology is very different from what we are encountering at present because it it gone too far when it comes to the platforms, when it comes to the establishment of softwares, when it comes to the upgrading of computers. So it's really different. But however, during that time, it already set the objective of the EO 119 to create the management advisory service so that to facilitate the records management on the internal, okay, internal meaning within their offices, specifically on government agencies, so that to organize the information and data and stored eventually on a specific mandate for every employees to do. So this is through the EO 119. And the vision of the knowledge management and information technology system or KMITS, DOH KMITS, is obviously to support the universal healthcare. Okay? When we talk about universal healthcare, this concerns health for all. So it means that every individual, regardless of age, has the right to access on health. And this may consider the vision of the KMITS, of the DOH KMITS, that the information communication technology is aimed into the direction of supporting the universal healthcare. And this is for the purpose of access, quality, efficiency, patient safety, and satisfaction. Remember all of this, okay? Because we always use accessibility. For example, as what I've told you in my previous examples, that when a mother who was about to deliver here in Manila, but she had her obstetric, okay, prenatal consultations in Mindanao, so the accessibility of the information, even from Mindanao, can be easily accessed with the authorized person who has the right to access will be mainly be considered as part of the vision because accessibility itself matters when it comes to a fast-paced work, okay, work, fast-paced work to attend to the client. Most specifically, this applies to emergency situations. How about supporting universal healthcare to improve quality, healthcare quality? So, if the information can be accessed easily and the doctors and nurses can access on the past medical history, on the previous hospitalization of the client who is about to deliver, then it could be more quality. It could rather promote quality when it comes to the care to be rendered to the client, simply because this may entail specifically on the perspective that the client received the appropriate therapeutic regimen. Because if, for example, the client has history of preeclampsia and the client's blood pressure has already revealed hypertension, and through the first that I had mentioned, that the information of the client's medical history can be accessed from Mindanao through the specific platform, then it could be a knowledge to the doctors and nurses to appropriately, okay, render the care management and prevent complications as well, because probably at the time that the increase of hypertension identifies already the knowledge of the history of pre-eclampsia. How about efficiency? When we talk about the efficiency, it will help the doctors and nurses to attend specifically and maximize resources available. If, for example, the client is having history of preeclampsia, then it will maximize the resources that may attend to the client's condition, such as the expertise on obstetrician who may have specialization in cardio, okay, in the cardiovascular. Probably it may also consider uh, obstetrician who may have advanced practice and specialization on handling high risk pregnancies. So this may entail accessibility, quality, and at the same time maximization of resources through efficiency. And through this access, quality, and efficiency, the number one uh, priority of why the IC this vision supports the UHC is the patient safety. Okay, the patient safety is the highest priority when it comes to all of these systems and procedures. Okay, so that when it comes to the ICT supporting the universal healthcare, the policymakers can able to participate when it comes to the enhancement of policies or improvement of policies based from the gaps, based from the identified problems, and based from the possible solutions that may give towards the improvement of the use of the knowledge management and information technology. When it comes to the mission is more on to the effectively use ICT to improve healthcare delivery, administration, and management in communicating health. So eventually, it's the use of the information and communication technology. It may not just only be the mission is on the administrative level, but moreover, this could consider on the level which is on the primary, and it concerns the patient care management. Now on the administrative level to improve the hospital operations, and as well on how it will cause specifically improvement on the system on a national level. So when we talk about the vision and the mission of the Knowledge Management and Information Technology Service, or KMITS, this will entail specifically the how the the nurses and the doctors will eventually be productive on this aspect. For the meantime, I will stop on this part, and I may have a part two of the discussion of the knowledge management and information Technology Service through the discussion of the structure of the Knowledge Management and Information Technology Service or KMITS. Thank you very much.